Dr. Sydney, we can get started now.
Okay, great. So good morning, good afternoon to all our partners and colleagues. Welcome to this first country roundtable organized by the Diagnostics Pillar of Access to COVID-19 Tools Accelerator, or ACT-A. My name is Sydney Yee, CEO of DXD Hub and co-chair of ASEAN DX Initiative. I will be co-chairing this roundtable today, along with Dr. Chikwe Ihekwazu, Director of the Nigeria Center for Disease Control, or NCDC. The objectives of this country roundtable today are twofold. First, to share relevant updates of what kind of support ACT-A is offering to countries, and also how to access the support. Second, and more importantly, to provide a listening forum for ACT-A to get feedback and input from countries on the support needed, as well as to share questions and challenges being faced on the ground. So the first part of the roundtable will include presentations and updates of the work done by the pillars and its partners. In the second part, we really hope to hear from you about the challenges you're facing in implementation and rollout of COVID-19 diagnostics and testing. So before we begin, I would like to inform that the presentations will be recorded, but the Q&A session will not be recorded. Translation in French is available. Please click on the French channel below to listen in French. I will now hand it over to my colleague, Dr. Chikwe. Dr. Chikwe, please.
Thank you, Sydney. Today really is a big day for the Accelerator, right? Testing is a critical element in the armory of tools that we have and we need to defeat COVID-19. Without it, we really can't detect the virus. We can't even begin a response. Patients can't have access to the care they need. The efficacy of vaccines can't be accessed. So we're literally blind without diagnostics, and which really is a big problem. We can't even detect the emergence of new variants, which is at the heart of the current dilemma that we face across the world. Major gaps in testing are putting lives at risk and threatening the progress we thought we were all making earlier this year with the ramping up of vaccination across the world. So there's an urgent need to scale up testing and ensure immediate and equitable access to diagnostic tools in every country in the world. The diagnostics pillar of the Accelerator exists to ensure that everyone who needs a test can get one done. And we are very, very far from where we need to be. You know, discussions in many countries in the West about daily testing or weekly testing, home testing, are miles apart from the reality in many countries in the world, like mine. So progress has been made, but there's a lot more ground that we need to cover. And we look forward to engaging with you, countries, during this session. And as Dr. Sydney said, this meeting really is about hearing from you. So we request all speakers in advance to stick to the time allocated so we can have a rich and full discussion at the end about what you need in your countries. I'll share some opinions myself because there's really a lot to talk about, and we've got to shape this agenda to focus on what the countries need. So I'd like to start and introduce the first session now. And I'll now ask my colleagues, Dr. Hannah, the Assistant Director, Dr. Hannah Balki, the Assistant Director General AMR, Antimicrobial Resistance at WHO, and Dr. Emma Haney, the Chief Access Officer of FINE, to tell us about the ACT-A Diagnostics Pillar and how it works. And remember, please keep to time. We will be strict about it. Over to you.
Wonderful. Many thanks, Chikwe. I'm going to cover for both Hanana and myself this morning, if that's okay. So what we're going to do is just take a couple of minutes to help give the context to the ACT Accelerator Diagnostics Pillar, but try to not speak very long because there's a number of excellent speakers that are following. And as we've already touched on, I think the most important thing for us to do today is actually to hear from all of you some of the questions that you have for us to dive into. So if we can jump on to the next slide. So as context, the ACT Accelerator is just over a year old. It was launched in late April 2020 by Dr. Tedros and the European Commission to accelerate access to the tools that are needed for the COVID response. And that includes both vaccines, but also therapeutics, diagnostics, and the health system's needs in order to respond effectively. Within that context, and the reason why diagnostics has its own pillar is because they are so critical, as you've heard from others, in the response. And that includes their role in breaking chains of transmission for COVID through effective test, trace, isolate programs. That includes supporting broader public health responses and to be able to know where the virus is and how to respond to it. Increasingly over these last few months, testing has had a new spotlight as the novel variants risk some of the gains made in therapeutics and vaccines, and our ability to detect those using diagnostic testing comes to the forefront. If we can jump on to the next slide. So the ACT Accelerator isn't a separate institution. So it is made up of a number of organizations who have the needed technical expertise and systems to be able to respond rapidly to the challenge for COVID. And that includes organizations such as FIND, the Global Fund, who co-convene the Diagnostics Pillar, and also organizations like Unitaid, Wellcome Trust, CEPI, Gavi, WHO, and the World Bank, who all act together as part of this broader coalition to be able to deliver on the tools needed in the COVID response. We can jump onto the next slide. So the ACT Accelerator has obviously a significant job in calculating what the resources are that are needed in order to respond to the challenge of COVID effectively. And the ACT Accelerator has laid out an investment case of some $38 billion in what's needed across vaccines, therapeutics, diagnostics, and health systems in order to respond effectively to that. And we've seen significant and positive response from countries largely and also other funding organizations to help meet some of that gap. However, there still does remain a $22 billion funding gap for the ACT Accelerator across diagnostics, vaccines, therapeutics, and the cross-cutting health systems connector. We can jump on to the next slide. So the diagnostics pillar, and I mentioned earlier, co-convened by the Global Fund and by FIND, but with actually quite active engagement of over 30 different partners in being able to deliver on the diagnostic tests that are needed, and quite widespread leadership across different organizations for different parts of the diagnostics pillar. The pillar itself is structured in an end-to-end way, so that includes a focus on the R&D side, on market shaping to be able to get the most effective, affordable, high quality tests out there, supply and procurement, as well as engagement on the country preparedness end. And then the most recent part that has been launched only over the last month or so is a new cross-cutting genomic surveillance working group co-led by Rockefeller Foundation and by WHO. If we jump onto the next slide, if we look back over the last year, really in that very acute emergency stage of the response, we have seen a number of successes through this broader partnership under the umbrella of the ACT Accelerator Diagnostics Pillar. And those include work from the beginning to accelerate access to additional tools in the toolkit for diagnostics. So expanding from PCR, which as we all know was a mainstay as a workhorse of diagnostics testing, to include a toolkit that includes antigen RDTs and other tests that are needed for the response, and to be able to ensure that those tests were available for low middle income countries as well, both through volume guarantees and then also through procurement through kind of key players such as the Global Fund, WHO, UNICEF, and others. And so I'm not going to run through all of these highlights of some of the work that's been done under the ACT Accelerator, but just to say, I think while there's been a lot of action over this last year for the challenge, we've also seen broadening both in the potential scope for the use of diagnostic testing in the public health responses and in some of those challenges. So if we look forward to 2021 on this next slide, you can see that there are 3 areas that we're really focusing on within the pillar, and you'll hear a little bit more about some of those today. today, because there's some of the areas we'd be very keen to get your feedback on. The first is around continuing to increase access to testing and scale the tests that we now have in hand, both PCR and rapid antigen tests, to be able to enable good test, trace and isolate, and in the future test and treat programs to be able to respond effectively to the pandemic. In addition, there's two other focuses of the pillar. One is around to accelerating access and continuing this process of decentralization of tests, which have moved from central labs to health clinics, but will now start to move into people's homes to be able to enable self-testing available globally, including in low middle income countries, and not just in high income countries that we've seen so far. And that includes work on the R&D side to get low cost effective self-tests. It will include work on the market shaping side, and then support on the country policy and regulatory side. So often those systems don't exist so much for self-testing at home versus professional use testing. And then lastly, and I've touched on this already, genomic surveillance is a critical part of that equation, feeding into wider surveillance efforts across respiratory diseases, and as part of a large number of efforts at the global, regional and country level to scale up surveillance, both in the context of COVID, but with a longer term view towards respiratory pathogens. So that's the 10,000 foot view across the work of the ACT Accelerator. I'm going to hand back to the co-chairs at this point.
Sydney?
Yeah, so hi, I think we have a second segment. Maybe we could have the next slide that shows the second segment. Yes, in this segment, we'll learn more about the work of ACT Accelerator's partners, FIND and WHO, on the various diagnostics tools, implementations and recommendations. We'll hear from Dr. Sergio Carmona, Dr. Sebastian Cornier, and Dr. Lara Votnov, and Constance McDonald-Thayer. Dr. Sergio, please.
Thanks, Sydney and Chikwe. So in a few minutes, I would like to let you share with you a couple of the trajectory that we've seen in the development of molecular tests and antigen RDTs in the last year. As Emma pointed out, from the inception of the ACT Accelerator, even before that, right, from the declaration of the pandemic to the publication of the genomic sequence of the SARS-CoV-2 virus, the development of the first molecular test was pretty impressive in a couple of weeks. It took a bit longer for the commercially available high throughput molecular test to become commercially available, and subsequent to that, the development of rapid diagnostic test, lateral flows that you see here. And soon after, in September, with the guidance published by WHO and subsequent emergency use listing by PQ, we have seen the enormous effort from industry and academia in the development of a pipeline that now looks pretty rich, of, as you can see here, of over 380 tests. So one wonders what is why are we still behind? Why is access to these tests still a problem? We see that then the number of tests that get listed under PQ or FDA, it's like a funnel that narrows it down quite significantly. And there are lots of reasons for this, including the quality of test, but also perhaps the capacity for validations and review of dossiers. All these areas need urgent attention as well. Next slide. So I want to show you something that we borrowed these slides from an EJM paper by Dr. Mina, but we can see that the more sensitive rapid tests can also detect infection earlier. But there's two things here. One is whether the test actually results in an understanding on infectiousness and the ability to transmit to others, or is it just detecting the viral dust, if you want, or the leftover of the virus without significant ability to transmit to others. So yeah, carry on, next slide. So early detection, you're being exposed, but there's no signal of either the virus itself or any protein. Then we start seeing early in the infection the ability of PCR to maybe detect the virus, but not rapid antigen RDTs. Next slide. Here's where you can see that both tests concur, and one shows that more closely that this is infections versus genetic material. Carry on. And then here's where we start seeing maybe some discordant results where the PCR is positive, but the antigen RDT is negative. And the reason for this is it's fairly well understood, as you can see from the viral load curve. We see now that some individuals can have detectable genetic material of the virus up to about 84 days post symptoms onset. And the next slide, and as Michael Minner points out, that rapid tests are contagiousness tests. They're extremely effective in detecting the COVID virus in people that are transmitting to others. So that's an important concept to understand when we compare one versus the other. Next slide. So there's always a bit of a trade-off, right? There's no single test that is absolutely perfect for all users. And here is just a depiction of what each of these can offer. If you're looking for speed, accuracy, sample type, throughput, or cost, you can see how one versus the other compares. Throughput, as Emma points out earlier, it's here the ability to bring antigen RDTs closer to the communities and do mass testing at a much faster speed, between 15 to 30 minutes, compared to something that is more centralized and fewer and very contained within laboratories, makes the difference. The ability also for RDTs to be much cheaper allows for perhaps more frequent testing in certain cases. So that's, in a nutshell, the pipeline, how these tests performed, and when we compare one versus the other, what the trade-offs are. Thank you, Chikwe and Sydney.
So thank you very much, Sergio. I guess we'll now, is Sebastian coming on? No, right?
Yes.
Okay, great. Please continue.
Can you hear me? Yeah. Okay. Good morning and good afternoon, everyone. I wanted just this morning to present the WHO activities, and particularly the strategic preparedness and response plan that has just been updated for 2021, to show that the ACT Accelerator is really a unique opportunity to accelerate the implementation of our WHO strategic plan that is usually also aligned with the national plans in the field at country level. The strategic preparedness and response plan has several pillars, and laboratories and diagnostics is the pillar 5 of our strategic plan. And for 2021, there are 3 priorities. First, it's really to increase testing capacity, particularly in the resource limited or the remote settings. And here we know that the expanded use of antigen RDTs is extremely helpful in this regard. Second, this is really to sustain the operational and logistical support for supply chains that is still sometimes fragile and not very solid in certain areas. And third, because of the emergence of new variants, this is to develop and implement cost-effective strategies and mechanisms to detect these variants. Next slide, please. So to support our member states, WHO has published several guidance on diagnostic testings, on testing strategies, the use of the antigen rapid test together with FIND. We have an implementation guidance. And at the bottom of the list here, you see also publications on genomic sequencing for SARS-CoV-2. And to support the implementation of these guidance documents, we have also developed together with FIND training materials, and we have a training package that is dedicated to the use of antigen RDT that you can download, and you have here the link on the slide. So I encourage you to consult all these recommendations, this document, and the training materials. And next slide, sorry, next slide, please. Yeah, so one of these guidance documents is looking at the testing strategy recommendations. And we have in this document a table that describes what can be the cost-effective strategy when you have no case, when you have sporadic cases, when you have cluster of cases or community transmission. And this document is under revision, and hopefully in the coming weeks we'll have a new document that further that updates a little bit our strategy recommendations, notably with the introduction of antigen RDTs that can be extremely helpful in certain circumstances. So we'll probably communicate more when the document, when the new document is published. Next slide, please. So I have mentioned to you all this guidance and the strategic plan. We have developed last year a new tool, a platform that is called the Partners Platform. So I really encourage you to sign in and to consult this platform, because this will be a unique place where you will find first the WHO strategic preparedness and response plan, an operational planning guideline that will really propose the key elements, the key actions that should be considered by countries, by the partners to increase testing for COVID-19. And you will also see all the publications that I've just shown in my previous slide. You will be able to download them and to consult them. So it's really a unique tool that hopefully will be helpful for you and for all our partners to support the diagnostics activity. And you will see here the link on my slide. I stop here and I hand over to the chair. Thank you.
So thank you very much. Can we have the slide for the next presentation up? So thanks. We've heard now from colleagues on testing strategies, on still waiting for the slide to come up for our next speaker. We've heard about what's in the toolbox, what the strategies are, what the setup is. So our third presentation will be by the Global Fund. And now they'll tell us on what the response mechanism has been, how countries have accessed some of these tools and tests, how they've been financed, and the structure of actually getting these to countries. So we'd now like to hear from the colleague from the Global Fund to take us to the third presentation. I'm still waiting for the slide to come up.
Sorry, Dr. Chikwe, we have two more quick presentations from WHO by Lara and Connie, and then we'll move on to Global Fund.
Okay, wow. So my apologies for that. Let's go on with that then.
Great, thanks so much. And just for everyone's information, my name is Lara Voinov at the WHO. And I think one thing we just wanted to touch on very quickly was around a mechanism that we developed probably nearly 14 months ago now, as the pandemic began, thinking about how we could support countries to increase access to diagnostics, especially as back then when the pandemic was breaking out, we really found some limitations in terms of low middle income countries being able to access the diagnostics when the pandemic was so global in nature. And so across a number of different partners, and this included WHO, Global Fund, UNICEF, and I could list probably 10 or 15 others, we came together to develop the Diagnostics Consortium to try and address some of these key strategies and issues. And effectively, it's a group of procurement bodies primarily. And over the last 13, 14 months, we've now procured over 73 million tests. We've also tried to develop an access and allocation framework in order to be able to support countries to more equitably access some of the diagnostics. And we know that we need to continue to refine this and improve as more information, more data is available. But some of these are really critical pieces that we thought were able to allow for some of the low middle income countries to access some of these diagnostics. We're continually also negotiating for lower prices across the different diagnostics and thinking about and understanding the role of sequencing procurement as well. I really just want to highlight a few of the different documents that have been developed across the Diagnostics Consortium, and in particular, this second to last document that really touches on some of the different options and opportunities that countries can have in terms of being able to support their procurement and their needs. And that is, there are a number of different avenues to take that countries could potentially take when requesting some of these different commodities. They can obviously go through the WHO, through our supply portal, through Global Fund, which it sounds like will speak very soon about their WAMBO platform and the C19RM. They can go through UNICEF and some of the other favored procurement bodies of each of the different countries in order to try to gain access and be able to receive some of these commodities in country. So I may just pause there, and of course these slides can be shared so you can review some of these links, and hand it over to Connie, who will touch on the essential supplies forecasting tool that the WHO worked on quite a while ago.
Thanks a lot, Lara. So for some background, the first version of the essential supplies forecasting tool was released back in March of 2020. There have since been 3 additional versions released. The initial purpose was to meet an urgent need for a quantification tool for both country level planning and operations for the global response, as well as for global advocacy by providing visibility into the scope of what was potentially going to be needed to support the COVID-19 response. The outputs of the tool include biomedical consumable and non-consumable equipment, diagnostics, PPE, and medicines, including anticoagulants and corticosteroids. Through various updates to the tool, we have reacted both based on feedback from users as well as to adapt the tool to the current situation as best as we're able to. And the tool uses case estimation methods and ratios for this quantification. And these are also updated to reflect as much as possible the current situation. So the 4th version was launched on April 15th of this year, and it functions in the same way as previous versions, but it offers updates including corticosteroids and anticoagulants. It includes antigen RDTs, and it also includes a new case forecasting option that uses data from Imperial College's robust epidemiology model. There are a number of different inputs that a user can select in order to create the forecast. And these inputs work with ratios, which are also modifiable, as well as the case estimation methods to provide a number of supplies that will be needed over a forecasted time frame. If we look at, or think about diagnostics specifically, if the tool quantifies the total number of tests needed for a period of time, as well as the PPE that will be needed for that lab staff. It allows users to indicate additional scenarios other than case finding, which include the testing of healthcare workers and the testing of contacts of positive cases. We are currently working in partnership with the ACT-A modeling group to build out a use case-based antigen RDT and molecular PCR module, and hopefully we'll be able to release that soon. So I think it's important to note that a focus for WHO with the recent launch of the 4th version is to continue to understand how this can be a repetitive use tool for countries. And we are really keen to work with governments and ministries of health to understand feedback and make rapid updates to the tool in order for it to have applicable utility for the country planning context. Ideally, this would be something that we could eventually template and it would be able to be used for other situations rather than just COVID, and hopefully for preparedness as well as just for emergency response. So we really encourage, please to reach out with any feedback as well as any questions about the tool. We're happy to set up trainings or time to talk it through. The ESFT has been referenced in the C19RM funding proposal guidelines as a resource for budgeting. And we're working on releasing a rationale for using the tool for the 2.5-year procurement forecast that we will be publishing soon. And version 4 is also, it's the first version so far that's available in Arabic, Chinese, French, Spanish, and Russian, and it will soon be available in Portuguese. And I think the last thing I'll say is that while there have been 4 versions of the tool released, there have been many 0.1, 0.2, 0.3 in between those big releases. And so while we do plan to release the 5th version with some big updates that we're already working on, it's really iterative. And so we are able to adapt and pull in information as things change. You know, an example of that would be a new use case for antigen tests, or if another technology becomes available, we can include that. And then not looking at diagnostics, but for things like pharmaceuticals, as more drugs come to market for the treatment of COVID-19, we will pull those in rather than waiting until we do another big launch. And then, yeah, so this slide right here just shows the links. We will be posting an updated FAQ to the website soon, as well as the actual tool. There is a pretty expansive overview and technical guidance, which talks through the ratios, the rationale, gives some suggestions for how to manipulate the tool for the scenario you're looking for. And then we are recording a webinar and training, which will be posted to the WHO website soon, as well as some live webinars, which will also be posted to the website. And I'll stop there. Thank you.
So thanks for that, colleagues. Apologies for the error earlier, but yeah, lots of tool strategies out there. I'm sure there'll be many questions from countries, so please start putting them together on how to actually access the 0.1, 0.2, 0.3 versions of the tools and make sense of them in our country. So now we will actually move on to the presentation from the Global Fund on how to actually access some of these diagnoses at the country level. So I'll invite Dr. Jacqueline to come on and share her thoughts with us on that. And please start thinking about your questions for what will be, I hope, a very vibrant Q&A session. Over.
Thanks so much. May I have the next slide, please? So quickly, I'll run through my slides and also hand over to colleagues to give you some details. I am Jacqueline Bataringa, and I head the C19RM Secretariat at the Global Fund. And today I'll just run through where we are at in the Global Fund's COVID-19 response. In 2020, we deployed around $1 billion, out of which 750 million was from C19RM. Going forward, we have a capacity of around 3.7 billion. So, but the categories of investments remain the same for COVID-19 response, adaptation and mitigating impact on the three diseases, as well as strengthening health and community systems. Next slide, please. This gives you a breakdown of how the 2020 investments were spread. I think to note that out of this, 182 million was for diagnostics and 276 million for PPE and around 12 million for oxygen. So there was a significant investment in diagnostics in 2020. A couple of lessons from 2020 was the lag between availability of funds and expression of demand, and the need to ensure that the countries are well supported for this, and ensuring that countries also understand the technical guidance that is out there. If we go to the next slide. So in 2021, as you see here, we have around 5 times the resources we had in 2020, which is a significant scale up that we collectively have to manage. And over to the next slide. We also expect that diagnostics will continue to be a significant part of this. And for these resources, we thank the US government for the 3.5 billion and Germany for 140 million euros. If we go to the next slide, the board approved C19RM extension on the 31st of March with some new elements in the way that we're managing the Global Fund response. First of all, we issued allocation letters to all countries that are eligible with a base allocation amount that's indicated in the letters, as well as an above base allocation. In addition, there are set submission windows for fast track, which allow countries to submit urgent requests for health products and full funding where countries may take more time to submit funding requests. There's a requirement for CCMs to engage communities as per usual practice of the Global Fund, but in addition to engage national COVID-19 response coordinating bodies. In 2020, we found that there are a number of countries where CCMs were not plugged into the national response, and perhaps that also partly explained why some of the requests we received didn't really have the same technical rigor we would have expected the submissions to have, and also alignment with national strategic preparedness and response plans that would have been expected, and hence the introduction of this requirement. In addition, there are a number of other updated areas, but most importantly, the definition of upfront technical guidance in collaboration with WHO and other partners. So if we go to the next slide. So who is eligible? All current implementing countries, including regional multi-country recipients and others that receive funding from the Global Fund. So going forward, next slide, is that the C19R will maintain speed, agility, but with increased transparency and rigor. So you'll start to have already seen that we're publishing on our website important information like the allocation, the funding request submission, projections, and other information. We'll also be publishing the funding requests once they have been reviewed and approved by the Global Fund Board or the Investment Committee. The structure of the funding is, as I said before, the C19RM base allocation, which is equivalent to 15% of 2020-2022 country allocations, which are also on our website, so you can easily calculate that, as well as the above base allocation, which is another 15% on top. For Fast Track, it's focused on urgent COVID-19 health products only, and we have a clear product list that countries can refer to, but the full funding requests then can also submit above base allocation. So how much a country will get for above base allocation depends on a number of factors, including COVID considerations, the level of disruption, availability of other funds, and how previously awarded funds have been utilized. If we go to the next slide, I think one thing to note here is that for fast tracks, as I said, fast track submissions, countries are able to access a portion of the 15%. How much of that 15% they submit will depend on the country's circumstances. Some countries are in such dire need of these products that they're going to use a significant amount of that 15%. And we encourage countries to submit significantly more than what we said in the letters of 7%, because indeed it's important to have the demand expressed holistically and also to ensure that the programmatic needs and the gaps are reflected in these requests. And in terms of the diagnostics, in what we found in 2020 was that it wasn't clear whether the countries had referred to WHO guidelines in terms of optimizing their testing strategies. So in some cases, one country would come with only antigen RDTs, and in some cases, another country will come with only PCR. So it's indeed important that countries get the support they need to submit the products as needed. Fast track submissions have been open since the 7th of April. And in fact, since then, we've received 9 fast track submissions from a range of countries, which I'll speak to as we get, I may in fact mention now, it's including India, the Gambia, Cambodia, Philippines, Malawi, Nepal, Togo, Djibouti, as well as Burundi, which came in this morning. If we go to the next slide. And so for full funding requests, it gives countries time to deliberate and have the discussions needed for the more complex interventions, including on disruption, on health systems, and on as well as on community interventions. Countries in some cases may need more time to deliberate, and they may in fact submit their funding requests in 2 parts to ensure that the principles of speed and agility are maintained. We would not want countries to be held hostage because one area hasn't been fully elaborated and are not able to submit funding requests. And the fast track mechanism allows that the health products requests can come in and orders can be placed immediately. If you go to the next slide. We included a number of key messages in the allocation letter. It's important for partners to understand why these messages are in there and also to use them as leverage in engaging with countries. First is the consistency with WHO guidance. This is a requirement. It allows during the review process to proceed quite rapidly. The appropriate engagement of communities and including community rights and gender-related interventions. We didn't get good uptake in 2020. This is a principle of the Global Fund, and we know that success is not possible without community rights and gender activities. To align with the national COVID response, full endorsement by the CCM. Some countries are submitting with this endorsement by the national COVID response coordinators, and what's happening is it's delaying approvals by the Global Fund because this is a requirement of our board, and it's important that they engage with the coordinators and align the plans, align the requests with the plans, and for us to see evidence of that. Submissions should be evidence-based, complement domestic and other sources, and focusing on the highest priority interventions to achieve, to optimize results and get value for money. And another critical element we are stressing is that our collective investments should be leading towards longer-term outcomes, contributing to future pandemic preparedness and partner engagement being strengthened around, for example, health security priorities. So it's important that we're not only looking at this epidemic, but also thinking about the outcomes we can get from having better pandemic preparedness for the future. If you go to the next slide. So these are submission windows, and 14th May is only next Friday, and we are expecting around 10 applications, and the tracker is on the website for you to know when different countries are coming in. However, at the end of these submission windows, any unawarded funds will be distributed across other areas where we have priority unfunded interventions, and funds should be used by the 31st of December 2023. Next slide. We can skip this slide and go to the next one. I'll hand over to my colleague Martin, who will speak to supply operations. Thank you.
Morning, everyone. So,
with an eye on time, please.
Yes. Good morning, everyone. Just to provide some emphasis around the importance of the products in the response to COVID-19 and how we are making sure that we're close to the active engagement to bring the new tools to scale. Point all the colleagues for detail on accessing health products to our website, where there's a lot of information on diagnostics around all of the mechanisms to deliver on all of the interventions that are needed to fight the COVID-19. We move to the next slide. Just to emphasize what Jacqueline said, the fast track, we've identified the optimal, what I call no regrets products, to be able to be quickly mobilized in a very accelerated way. The optimal products in the diagnostic space include all of the antigen RDTs and PCR reagents so that we can continue and scale up the testing. We also segment the products into strategic and local sourcing to maximize the access of those products. Strategic products are the sort of things that Lara was talking about, where there is scarce global demand and where we are making sure that we maintain the principles of equity and not first come, first served. So now I'll hand over to Fatim, who's going to talk about laboratory.
Thank you so much. So for diagnostics and lab investments in lab in funding requests, we have in Annex 2 of the technical information note 4 different packages and to support the national COVID-19 diagnostic strategy. And the packages are tailored based on the country stages of the response and lab systems readiness level, stemming from the early phase of implementation to mature phases of implementation of their COVID-19 diagnostic strategies. So countries can include in their funding request support for one or more of these packages. And these include package 1 shown here, which focuses on introduction or scale up of antigen RDT. Package 2 includes support to scale up molecular diagnostics. whilst package 4 would include activities to support genomic surveillance. And of course, taking note of the requirements for fast track, packages 1 and 2 can be included in fast track. Finally, package 3, which cuts across the aforementioned packages, includes activities to support strengthening of integrated lab networks and support and systems to support diagnostics, antigen RDT, PCR, as well as genomic surveillance. Over. Thank you.
Good, Jacqueline, is that the end
Yes,
of the...
David, we have one more colleague. So David, 1 minute, if we can, so that we can wrap up and hand over back.
Okay, please.
Hi, good morning. Thanks, Jacqueline. So really quickly, just a couple notes on our technical guidance and partner engagement. We did update the technical guidance along with the application materials and related communications, working closely across ACT-A pillars with a number of technical partners. And of course, our technical guidance is all founded on WHO normative guidelines. In terms of partner engagement, first and foremost at country level, is depicted in the graphic on the right. The CCMs continue to have, of course, the primary role in governance related to the development of funding requests, but the innovation here has really been to bring the CCMs together with the national COVID coordinating bodies to ensure that there's a strong collaboration in developing funding requests, both fast track and full. Of course, we have the standard array of partners from civil society and community to various technical partners represented on the call and within ACT-A, and particularly those that have presence at country level who are engaged with the response and or on the CCM side. We've been looking to those partners to really engage the funding request development process and support strong requests. Next slide, please. I think if you look at the lower right, just to start with the emphasis on the WHO, the updated operational guidelines, the strategic preparedness and response plan framework that has been adopted is really kind of the end-to-end organizing framework for our technical guidance, including the C19RM information note. We've built out, working closely with a variety of technical partners, a number of the key areas that are about COVID control and containment. Fatim highlighted the content around the lab packages that features in Annex 2, and we have similar, more detailed guidance, particularly in some of the key areas in infection prevention and control, as well as in clinical therapeutics and medical oxygen. Now this, the C19RM note, technical information note, complements the consolidated HIV, TB, and malaria mitigation note, as well as the community systems and response notes. These have been aligned, and in the C19RM note, you'll find it does kind of serve as one-stop shopping because we have a bridge content from the other two notes contained therein. I'll stop there and turn it back to Jacqueline. Thank you.
Thanks so much, David. So the question is, where are we today? So as I mentioned before, the allocation letters were all sent out by April the 13th. And so all countries that are eligible have received these letters and would be aware of the funding. The materials are on our website, as colleagues have mentioned, and we are already receiving fast track funding requests. If we go to the next slide. Next slide, please. So as just to note that we have 41 countries that have registered to submit fast track funding requests, and as said before, that 9 of them have already come in, and we're expecting the remainder bulk of it to come in the rest by end of May. And for the total volume is for around 589 million. The board has reserved 900 million for fast track. And as I said before, most of this is for COVID-19. All of it is for COVID-19 health products that are needed urgently. On the next slide. 117 applicants have registered to submit full funding requests. There was a question of whether this facility is still open. It is open, and we encourage countries to register to submit their funding requests so that we can all plan accordingly. And if they all come in, and assuming a 30% base and above base allocation, it's for $3.66 billion. And finally, in terms of the last slide, if you go to the next steps. So in terms of next steps, we are looking to partners to support countries to submit ambitious fast-track funding requests. And for those that haven't considered this opportunity to do so, as that would enable countries to access the diagnostics, PPE and oxygen as urgently as possible, and as said, in line with the country circumstances and programmatic needs, and also to start planning for the ambitious full C19 requests. In the full request, they can again consider diagnostics as needed, and to ensure that the CCM is engaged with national coordinating bodies as well as partners, so that requests have the technical rigor that is needed to be approved rapidly. CCMs have been given additional resources to be able to do so, and so we feel that the engagement should not be a problem. So back to you, and thank you so much for listening to the Global Fund.
Thank you, Jacqueline, and the colleagues and the team from the Global Fund. So we've now heard about various diagnostics tools, testing strategies, funding opportunities. It is timely to also hear from our colleagues in civil society organizations in country. The civil society representatives are key partners in making the work of ACT Accelerator a success. So we have brief interventions from Dr. Fifa Rahman, permanent civil society representative on the diagnostics pillar, and Dr. Dieudonné Mwamba Kazadi, director of the General Directorate for the fight against disease in the DRC. So we'll start with Dr. Fifa first and followed by Dr. Dieudonné. Dr. Fifa.
Thanks so much. So I'm going to be quick because we're over time, and I do want to hear from countries, but we have 2 points, and CSOs have been really concerned about sort of 2 things. And the first thing is sort of equity, because what we're seeing is rapid antigen tests are being used differently in the global north and the global south. And I live in the global north, I live in the UK, and these are my rapid antigen tests, which I ordered for free over the NHS. I am able to manage my risk if I feel symptoms on my own, but we know that the WHO guidance is quite restrictive as it stands. So what we want to see is broader guidance that maybe employs, while we're awaiting evidence, the precautionary principle in community-based testing. And this brings a little bit of a dilemma for us as CSOs, because as you saw from the presentation by Global Fund colleagues, the C19RM requests need to be consistent with applicable guidance. At the same time, the programs requested under C19RM will go until 2023. And so the guidance that is available now may change in 6 months or 12 months down the road. And so we see a necessity for some kind of precautionary guidance around community-based testing. And we think it's a real missed opportunity if this isn't adopted. We of course know that in the global north, tests are being used in schools and universities, at workplaces, and as you can see, in homes. So, you know, it would be useful to have some guidance for community-based testing so that countries, when they're submitting their C19 requests, they can anticipate for the guidance changing in the near future. And those are our main concerns. So I'm pleased to give the floor next to Dr. Dieudonné Mwamba, who is the head of epidemiological surveillance of the Ministry of Health in Democratic Republic of Congo. Dr. Mwamba, you have the floor.
Oui, bonjour à tous. J'espère que vous me suivez. Est-ce que vous me suivez?
Oui, c'est bon.
Oui, bonjour, je vais intervenir bien sûr en français. Au niveau de la République démocratique du Congo, effectivement, nous avons un challenge pour l'accès aux différents tests. Et ce qui fait que notre capacité de dépistage demeure encore assez faible, justement parce que à cause de la faible disponibilité des tests. C'est ainsi que nous n'arrivons pas à tester tous nos cas suspects. Et la stratégie que nous voudrions maintenant mettre en place, c'est rendre ces tests, surtout les tests rapides, antigéniques, au niveau de structures locales, au niveau de nos zones de santé, pour permettre à ce que le dépistage, non seulement il doit se faire au niveau des cliniques ou des hôpitaux, mais qu'on puisse aussi, comme l'intervenante précédente venait de dire, au niveau communautaire. Mais au niveau communautaire, il faut que ces tests soient rendus disponibles. Malheureusement, nous n'avons pas assez de ces tests disponibles au niveau des zones de santé et au niveau de la communauté. Donc, cela demeure aussi un challenge au niveau de la RDC. Et même en plus, au niveau de nos frontières, nous avons plusieurs frontières. La RDC, c'est un grand pays avec 9 pays voisins. Donc, et nous nous rendons compte que souvent en RDC, la plupart de notre épidémie, c'est les voyageurs qui viennent de l'extérieur qui amènent les cas dans le pays. Et nous avons l'obligation de renforcer la surveillance au niveau de nos frontières. Et là aussi, il faut que ces tests soient rendus disponibles à ce niveau-là et à toutes les frontières. C'est ainsi que nous, au niveau des frontières, essentiellement, nous utilisons les tests PCR pour les voyageurs venant de l'extérieur du pays. Et nous sommes en train de réfléchir comment on pourrait aussi mettre les tests rapides antigéniques au niveau de nos différentes frontières. Et là aussi, il se pose ce challenge d'avoir ces tests en permanence à toutes nos différentes frontières. Donc voilà un peu les différentes situations au niveau de la RDC. Je vous remercie.
Good. Some hard, thank you very much, my brother, some hard truths and realities from the country level. So before we go into the Q&A session, I hope you're all getting your questions ready. Just looking at the Q&A, I already see some good questions coming in. Please keep them flowing and like them so that they move up as quickly as possible, and we'll curate and take the ones that seem to be the most liked that move up on the priority list. So please keep your questions coming. But before we start, we have so many stakeholders in the room. The ACT-A team will now like to use this opportunity for a quick poll, which will help better facilitate country implementation, develop new technologies, or improve existing ones. So I'll ask them to kindly launch the poll, and then we'll look at the answers and then proceed from there. So please, team, can you go ahead?